Tell us about some of the signs you see inside the eye when somebody is at risk for cardiovascular disease.
That's a great question. So, one of the things that I've been able to pick up on, we like to talk about smokers, for instance, and smokers have, um, uh, are going to develop cataracts and macular degeneration 10 years earlier than non-smokers. Well, if you're really observant, looking at the outside of the eye, on the white of the eye, you can see little microaneurysms in your smokers. And this is an indication that the patient is becoming is or was vitamin C deficient, because vitamin C is the major antioxidant, extracellular, outside the cell antioxidant, and it's highly dependent in humans on dietary intake of plant food, vegetables, and fruit. And so I can often pick this up in smokers, and also certain cataract types can indicate an enhanced ability to develop cardiovascular disease, which is tied into something called insulin resistance, which Carrie and I have studied together. But we can identify early diabetes from the outside of the eye as well, and subtle lots of little subtle things that we pick up over the years if you know what to look like. Even a fluttering eyelid could indicate a magnesium deficiency. And your magnesium status is one of 8 very, very important biomarkers determining, how well you're going to do down the road. So there's lots of things. So I mentioned the outside of the eye. I mentioned the conjunctival outpouchings. Even just Kerry, just uh, asking the question or putting your stethoscope up and trying to screen for an abdominal aneurysm in patients. So if patients are at risk for these microaneurysms, they also may have bulging blood vessels, arteries in their abdomen. Okay, so you could counsel them to have an ultrasound, and sometimes pick up in a large aortic aneurysm of significant size, that it's life threatening. Also, as you know, you look at the retina, and the retina can tell you whether a person has mild, moderate, or severe arteriosclerotic disease. And it's pretty easy to spot the patients who are usually younger and don't have much atherosclerosis in their retinas. And it's pretty simple. Even a first or second year optometry student could diagnose whether the patient has something called papilledema, where there's such hypertensive papilledema, where there's such severe changes to the optic nerve and the blood pressure is elevated typically. But it's those in between decision points, where the patient doesn't have a little bit of disease and they have or a lot of disease, but they're kind of in the middle, and you have to ask the questions. Did you have a mother or father who died of a heart attack or a stroke? And that's where I move into action. In combination with looking directly at the blood vessels, I'm able to ask those questions. Was there any premature death in your family? And often they'll come out and the patient will say, yeah, my relatives have not lived past 50. And then what I do is of course, alert their primary care doctor, notate in the chart that they have accelerated atherosclerosis based on looking at the retina. But what's important to understand is those exact changes are occurring in the heart and the kidneys and the brain. So you're going to get multisensory impairment, multisystem impairment when you see things happening in the retina. So it keys you in that we need to move to not only looking at cholesterol and triglycerides and so forth, the things you hear about all the time from your doctor, but we run a series of tests that is called a vertical serum analysis, which are advanced tests. Some of these tests you can run, and typically are run if you've had a heart attack or a stroke. But as an optometrist, I like to identify these before the patients had a heart attack or stroke. So I will often have these tests run, interpret the tests, because there's standards for the tests, And then in many, many cases, these tests require nutritional supplementation in addition to the obvious changes in lifestyle, controlling blood pressure, blood sugar, lipids, and so forth. You can actually make recommendations, which we've done many times. It's sort of what I do. And I try to teach this to students because many students are not getting and this information. And I don't like to leave it to my brethren in ophthalmology because they're used to working on acute conditions, emergency situations, surgery. So they're into doing things to people. What I try to reflect is doing things for people by providing them information on how they can improve their lifestyle, on how they can, better their own lives by taking matters into their own hands.